I want to thank everyone for coming out for this briefing this morning. I'm proud to be joined today by elected leaders, county administrators, school officials, and first responders from throughout the Metro Richmond region. With us today, we have representatives from the city of Richmond, the counties of Henrico, Chesterfield, Hanover, and Goochland. I'm also thankful to have with us one of Virginia's leading public health officials, Dr. Danny Avula, head of the Richmond City and Henrico County Health Districts, to provide you and the residents of our region an update on our response to COVID-19 and reliable information so you can stay informed going forward. As you all know, Governor Northam yesterday declared a state of emergency in the Commonwealth of Virginia. And today we have gathered here united as a region to take similar actions. In light of the imminent potential threat to the public health and public safety, I am declaring a local state of emergency in the city of Richmond effective immediately. This state of emergency will coincide with the 30-day state of emergency declared by the governor of the Commonwealth of Virginia. These declarations will enable us, working in concert with the state government, to act swiftly and responsibly to marshal resources. And they will enable us to work collaboratively to address the needs of our communities as COVID-19 evolves in our region. To bring you up to date, already we have activated our regional incident management team of first responders to coordinate our efforts on the ground. We also have convened leadership from our surrounding jurisdictions to meet on a regular basis. These leaders have pledged to work together to share our resources and to participate in a supply chain that ensures all localities will have regional support they need to respond to the challenges of COVID-19 in their own backyards. To keep the public informed, there are several websites that we would appreciate you distributing through your news outlets. In the city of Richmond, the website is www.richmondgov.com/COVID-19. For the Centers for Disease Control, it's www.cdc.gov/coronavirus/2019. And for the Virginia Department of Health, we ask that you visit www.vdhvirginia.gov. While this infectious disease has yet to become prevalent in our region, we know that the numbers will grow. And we've already seen the examples of communities and countries that are being seriously challenged because they did not take the early steps to address community spread or realize the threat of COVID-19 poses until it already is on their doorsteps. The leaders of this region are choosing a different path. We choose to stand together and to be prepared and do everything in our power to minimize the impact it will have on the residents of our region. We know that the coronavirus knows no borders. It does not know what county it's in or what city it's in. We know that an ounce of prevention is worth a pound of cure. And we know that in order to meet this health challenge head on, we must plan together, prepare together, work together, and fight together to keep our people healthy and safe and to protect our local economies. That is why we have taken some important steps recently to minimize the potential for community spread by encouraging people to avoid large mass gatherings, practice social distancing, and follow common sense personal hygiene protocols. For the last couple of days, I have spoken with business and Chamber of Commerce leaders and faith leaders and encouraged them to follow some similar guidance and to explore providing options to telework and liberal use of sick leave. And I know I speak for all the leaders here when I say we appreciate the steps taken by the business community, the faith community, and the numerous community partners throughout our region who had planned activities in the coming weeks and either postponed, canceled, or rescheduled their events. The leaders of our public school systems and higher education institutions should also be commended as well. They've taken steps to mitigate the potential for this disease to gain a foothold in our families and impact our most vulnerable populations. All recognize the seriousness of the potential threat posed by COVID-19. They did the right thing. We're all doing the right thing. They put public health above personal and organizational interests, and that is the spirit in which this group comes together today. So, ladies and gentlemen, at the end of the day, no matter where you live, the health and safety of our residents must be our highest priority. And I'm proud to stand here today with regional partners who know that the best way to protect our localities is to stand, albeit socially distanced, stand together as a region. I thank you for being here, and now I'd like to bring up Dan SCHMITT, the Vice Chairman of the Henrico Board of Supervisors.
Thank you, Mr. Mayor. Good morning, everybody. On behalf of the Board of Supervisors and the administration of Henrico County, I appreciate the opportunity to be here with you all this morning. Henrico County stands in partnership with our neighbors, Chesterfield, Hanover, Goochland, and Richmond, and the Commonwealth in declaring a state of local emergency over the COVID-19 coronavirus. As you're aware, this outbreak is extremely serious and evolving quickly. In Henrico, we are monitoring the situation closely and are ready to do whatever is necessary to address whatever threats this pandemic poses. You're already seeing this in the difficult decision to close schools in order to ensure the safety of our children. Regionally, our efforts are being directed by the Central Virginia All Hazards Incident Management Team. These efforts extend through the tireless work of our first responders and public health workers. Let me just take one extra second and thank the members of this regional team, not just the outstanding efforts of Jackson Baynard and Danny Avula and the Henrico delegation, but of all the members from our partner jurisdictions who are once again proving the power of regional collaboration for the benefit and protection of our collective constituents. By declaring a state of local emergency and by working regionally, we will be ready to mobilize whatever resources are necessary. We also will be ready to tap additional resources from the state and federal governments. We understand this is an unusual, inconvenient, and perhaps frightening time, but it's critical that everyone remain calm, stay informed, and follow the CDC's safety recommendations. Henrico will continue to provide updates on our website, henrico.us, as well as on the Henrico County government accounts on Facebook and Twitter. As local officials, the greatest responsibility we collectively accept is to protect the health, safety, and general welfare of our residents. This is exactly what we are doing with our emergency declaration and our work as a region. At this time, I'd like to turn it over to my friend and colleague from Chesterfield County, Chairwoman Leslie Haley. Thank you.
Thank you, and hello and welcome, and I bring greetings also on behalf of the Chesterfield County Board of Supervisors. And thank you for giving me a few minutes to update what we too are joining in this collaborative partnership in Chesterfield. As we work with our partner localities to address this potential regional impact of COVID-19, Chesterfield also stands ready to act. Working with our counterparts to declare a local state of emergency is in the best interest of Chesterfield and of our entire region. As we move through this process, Chesterfield will continue to work collaboratively to monitor this evolving public health issue. Our number one priority is to make sure our residents, our businesses, and our visitors are aware of the latest information and the precautions they need to take. Last week, we developed a dedicated webpage at chesterfield.gov/coronavirus that provides current updates issued from our county, as well as links to resources and to find the most current information from the CDC and from the Virginia Department of Health. In addition to Chesterfield's dedicated response to COVID-19 webpage, I encourage our residents to follow Chesterfield's various social media accounts to stay informed as we work through with our regional partners to share reliable and regional information on a current and up-to-date basis. Chesterfield, as with our partner localities, is equally as committed to the health and safety of its employees and minimizing the risk of exposure and transmission of the viruses through the workplace. And therefore, we will continue to review precautionary measures such as restricting travel, rescheduling large events, and following other best practices. We're very well aware that we want our citizens to be able to maintain a lifestyle, and we recognize that there are certain citizen groups that are more at risk than other groups. We want our folks not to be engaged in an alarmist perspective, but a perspective of being well informed about the issues and the potential risks they face. And let us keep in mind that while the CDC and the Virginia Department of Health continue to emphasize the risk is low, there are these higher risk individuals and these special populations that seem to be at this greater risk, and we need to be very mindful of them on a continuing basis. These are particularly older adults and people at all ages with severe underlying health conditions. And the information that's out there, potentially on social media, that may start to get people a little bit anxious, let's hope and continue to direct our folks to the reliable information that all of these jurisdictions are committed to provide. We're encouraging our residents who are potentially in these at-risk populations to be particularly mindful and to seek services, including services that all of our localities are able to offer, to provide them not only guidance but assistance as needed. Chesterfield will continue to remain vigilant in this situation as it continues to evolve, and we know that we are particularly involved right now in a budget season, holding community meetings. We are doing everything we can to bring these meetings, live streaming them to you. Starting on Monday with our first public hearing in the evening, we will be running that on a Facebook Live for folks to be able to participate as well through online comments and questions. So we will continue to update and communicate that to our citizens. So we will continue to remain vigilant, and as this situation evolves, we will adapt, we will take precautions, we will communicate, we will attempt to meet the needs of our citizens on a daily and hourly basis. I so appreciate being here as part of this regional partnership and representing Chesterfield. This is a partnership that is serving our entire region so well. And with that, I want to turn this over to my friend and colleague, the Vice Chair of the Hanover Board, Mr. Davis.
Thank you, Leslie. I'll be brief. Thank you very much. Good morning. My name is Sean Davis, and I serve as the Vice Chairman of the Hanover County Board of Supervisors. Thank everyone for being here. Members of the media, thank you for helping us get this vital information to the public. On behalf of the board and the entire county administration, I am honored to be here to speak to our citizens, calm fears, but provide relevant information. I am also glad to be joined by our school superintendent, Dr. Michael Gill, and Chief Jethro Pylan with the Hanover County Fire and EMS. Likewise, I had an early morning meeting with Colonel Sheriff Hines this morning, and he is fully committed to maintaining the public safety of Hanover County. The health and safety of all residents is our primary concern. Therefore, it is important that Hanover County immediately declare a local state of emergency. We are joining with our regional partners to share our resources and coordinate our efforts. The health and safety of Hanover residents, as well as all of those in the Richmond region, is our primary concern. Hanover will be a committed partner in all regional and state efforts to serve our citizens of our county, the Richmond region, and our Commonwealth. Working together, we will aggressively combat this public health emergency, and in doing so, continue to serve our citizens at the highest level. Hanover will be a committed regional partner and a committed partner in all state efforts. We will work together as we combat this virus. This virus knows no boundaries, but we will work together to combat this public health safety emergency. I've been in touch with many folks in our public sector businesses, and we urge those folks, to the extent possible, to follow safe protocols. While we cannot mandate certain criteria, we do ask that large meetings of 250 or more be curtailed, again, to the extent possible, and that all folks recognize that pertinent information will come from reliable sources. That will include websites from your county governments and our regional partners. Thank you very much. My apologies. I do want to introduce my dear friend and colleague, longtime friend and colleague, Chairman LASCOLETTE from Goochland. My sincere
Don't touch me. Good morning. I'm Susan LASCOLETTE, Chair of the Goochland County Board of Supervisors. And on behalf of the Board of Supervisors and Administration of Goochland County, I appreciate the opportunity to be here today. Goochland County this morning, in conjunction with our regional partners and the Commonwealth, is declaring a state of local emergency in response to the continued spread of novel coronavirus or COVID-19. This action allows us to take additional steps as a region to dedicate resources and protect our communities. Working together as a region is our top priority to make sure our residents and our visitors stay safe and healthy. Goochland County will continue to review precautionary measures such as limiting employee travel, limiting large events, and indoor use of county facilities. Through continued preparation and collaboration between localities guided by the Central Virginia All Hazards Incident Management Team, we will continue to monitor this pandemic and support each other in our regional response. So thank you, and that's my honor to turn the podium back to Mayor Stoney.
Now I'd like to bring up Dr. Danny Avula, the head of the Richmond and Henrico Health Districts. Dr. Avula.
Thank you, Mayor Stoney. I really have been grateful for the leadership of our region over this last week. This has been an incredible amount of collaboration and humility and intelligence and just really decisive decision-making as a group. It's been really remarkable to be a part of it. As public health, we always try to provide the best guidance possible based on good data. The challenge that we have been facing as a state and as a nation is that our access to that data has been fairly limited because we've had really limited testing capacity. And as a result, we only have a partial picture of what's been going on with COVID-19 around the country. We only have a sense of just the degree to which it's moving in our communities. What we do know here in Virginia is that in just a matter of days, it has gone from 3 cases to 9 cases to 17 cases, and that will be even more today, as I know colleagues of mine are working up cases around the state as we speak. And I expect fully that these numbers will grow significantly as testing expands around the state. We also know that this is not the flu. There's no vaccine to COVID-19. There is no treatment outside of supportive care, no effective antiviral medications. And the early reports are showing that it is somewhere between 10 and 20 times more deadly than the flu across the globe. As we've watched the disease spread around the world, we have seen the epidemic curve, which is the normal bell curve that most infectious diseases generally follow. We've watched that curve in China and Korea and Italy, and we've seen that curve reach peaks that are completely stressing and overwhelming the healthcare systems and the healthcare infrastructures in those communities. We have got to figure out how to keep that at bay. Here in the Richmond region, we are blessed with a phenomenal healthcare infrastructure. We have 3 top-notch healthcare systems who are more than equipped to provide the kind of supportive care that is going to save lives here in the region. But if COVID-19 overwhelms the healthcare system, it's going to lead to many preventable deaths, not just from COVID-19, but from other causes, from folks who couldn't get in the hospital because the health system were overrun. While most of the folks who get COVID-19, 80% or so, are going to contract very mild disease, we do know that 15 to 20% of individuals with this disease will require some more acute intervention, and 5% really requires more intensive intervention like ventilation. So we have got to do everything we can to flatten that epidemic curve. We need to prevent that surge of disease that's going to overwhelm the healthcare system and stretch out the epidemic so that our healthcare infrastructure can keep up with the demands that it's currently and even more so going to face over the next days and weeks. And that is going to require some fairly drastic measures. declaring a local emergency like you've heard today. We also are going to need to change the norms of our social interaction basically overnight because if we're going to minimize the transmission of virus. You know, all the messages you've been hearing about hand washing and face touching and handshaking and self-isolation. You know, I've engaged in more fist bumps and elbow bumps in the last week than I have in my entire life. But that's good. It's showing that this social change is happening fairly quickly. You have heard some very significant and well thought out decisions around school closure. You've heard a lot of talk about social distancing and the advisement by this region to cancel large gatherings of greater than 250 people. Those are all very significant steps, and they're the kind of steps that are going to be required to flatten this epidemic curve. And this part is crucial. These interventions need to be enacted early enough to make a difference. You've heard me say a lot over the course of this past 2 weeks that we don't know a lot of about this virus, that it's only been kind of 3 months as traversing the world over the last 3 months. But while we're still learning about COVID-19, we do know from our experience dealing with pandemics that the interventions that actually make a difference always need to be taken sooner than we think. And so that's what you're seeing here. You're seeing bold leadership by our region, because to many in our community, these steps may not seem necessary right now. And so many times over the course of the last couple of weeks in our conversations, we've said we don't want to feed into the anxiety and the panic, and that's absolutely true. And I want you all to hear that these measures are not out of fear, but they are an act of prevention and compassion and preparation. Compassion particularly for the most vulnerable individuals of our community who are going to feel the brunt of this disease. As I've thought about this crisis, I've recognized that this is a remarkable opportunity for our entire community to rally around one another, to protect one another, and to love one another. Thank you.